Hey guys, Sam here. Welcome to our Vascular Sonography Registry review. Feel free to pause the video after I ask the question, give enough time to answer it before I answer it. Let's get started. Question number 1. Which of the following can happen regarding this carotid artery body tumor? A. The ECA resistance will increase. B. The ECA resistance will decrease. C. The ICA resistance will increase. Or is it D. The ICA resistance will decrease? The answer is B. The ECA resistance will decrease. Question number 2. Plaque buildup in the arteries causing disease is an accumulation of what? A. Lipocalcium. B. HDL. C. Lipoprotein. Or D. Platelets. The answer is C. Lipoprotein. Question number 3. Approximately how many valves are in the segment between the inguinal ligament and the popliteal fossa? A1, B10, C5, or D16? The answer is C, 5. Question number 4. How many valves are in the inferior vena cava? A5, B1, C0, or D, 6 to 12? The answer is C, 0. Question number 5. Which of the following is a contraindication for a pseudoaneurysm closure? A. Ibuprofen medication. B. The width of the pseudoaneurysm base is 2 to 3 centimeters. C. The pseudoaneurysm is in close proximity of the common femoral artery bifurcation. Or is it D. The width of the pseudoaneurysm sac is 4 to 5 centimeters? The answer is B. The width of the pseudoaneurysm base is 2 to 3 centimeters. Question number 6. What is occurring during the waveform labeled 2? A. Atrial contraction. B. Early ventricular contraction. C. Late ventricular filling. Or D. Atrial filling. So what's happening right here? The answer is B. Early ventricular contraction. Question number 7. An ulcer on the medial malleolus indicates what? A. Acute arterial ischemia. B. Arterial insufficiency. C, venous insufficiency, or D, acute deep vein thrombosis? The answer is C, venous insufficiency. And also, this will be close to the posterior tibial veins. Question number 8. The dichrotic notch indicates what? A, aortic valve opening, B, aortic valve closing, C, systolic contraction, or D, atrial contraction? The answer is B, aortic valve closing. Question number 9. What is occurring during the waveform labeled 5? A, late atrial contraction, B, early ventricular filling, C, late atrial filling, or D, early atrial filling? So what is happening right here? The answer is B, early ventricular filling. Question number 10. Lets reflection occurs for PPGs for which of the following types of blood flow? A, plug flow, B, laminar flow, C, decreased flow, or D, increased flow? The answer is D, increased blood flow. Question number 11. Which of the following complications occurs when the distal arterial blood flow shunts to the lower resistant venous circulation? A, CHF, B, Steele syndrome, C, false aneurysm, or D, true aneurysm? The answer is B, Steele syndrome. Question number 12. What is occurring during the waveform labeled 3? A, atrial contraction, B, early ventricular contraction, C, late ventricular contraction, or D, early atrial filling? So what is happening right here? The answer is C, late ventricular contraction. Question number 13. A patient returns to the hospital 2 days after a liver transplantation complaining of severe abdominal pain. What can you expect to see on the ultrasound? A, hepatic vein clot, B, IVC clot, C, true aneurysm formation, or D, hepatopedal hepatic vein flow? The answer is B, IVC clot. Question number 14. Which of the following complication occurs when large volumes of arterial blood flow shunts to the low resistant venous circulation? A, CHF, B, dissection, C, false aneurysm, or D, true aneurysm? The answer is A, CHF, or congestive heart failure. Question number 15. An ulcer on the bone prominence indicates what? A, total occlusion, B, arterial insufficiency, C, venous insufficiency, or D, acute deep vein thrombosis? The answer is B, arterial insufficiency. Question 16. What type of artifact will resemble a carotid artery dissection? A, enhancement, B, reverberation, C, grading lobe, or D, mirror imaging? The answer is B, reverberation. Question 17. Where is an arterial PPG recorded from? A, inside the artery, B, under the skin, C, as close to the heart as possible, or D, surface of the skin? The answer is D, surface of the skin. Question 18. This patient is at most risk for what? A, dissection, B, occlusion, C, ischemia, or D, syncope? The answer is A, dissection. This ultrasound represents a patient with fibromuscular dysplasia or FMD. Question 19. Which is the most frequently common non-threatening complication of a DVT? A, pulmonary embolism, B, venous insufficiency, C, sudden death, or D, stroke? The answer is B, venous insufficiency. Make sure you pay attention to your questions and how they're worded, because this is saying non-threatening complication. Obviously, the most common life-threatening complication would be a pulmonary embolism. Question 20. What is occurring during the waveform labeled 1? A, atrial contraction, B, early ventricular contraction, C, IVRT, or D, atrial filling? So what is happening right here? The answer is A, atrial contraction. Question 21. An arterial spectral Doppler indentation on the peak systolic velocity in the common carotid artery is caused by what? A, total occlusion, B, lipoprotein plaque, C, aortic valve closure, or D, subclavian steal. The answer is C, aortic valve closure. Question 22. What type of exam does this image represent if radiopaque contrast was injected into the common femoral vein? A, descending venography, B, ascending venography, C, magnetic resonance venography, or D, CT venography. The answer is A, descending venography. Question 23. Which artery usually has one pair of veins in the upper extremity? A, subclavian, B, axillary, C, brachial, or D, basilic? The answer is C, brachial. Question 24. Median arcuate ligament syndrome is also known as what? A, Dunbar syndrome, B, compartment syndrome, C, May-Thurner syndrome, or D, Budd-Chiari syndrome? The answer is A, Dunbar syndrome, also known as celiac artery compression syndrome. Question 25. What type of exam does this image represent if radiopaque contrast was injected into a vein in the dorsum of the foot? A, descending venography, B, ascending venography, C, magnetic resonance venography, or D, CT venography? The answer is B, ascending venography. Question 26. Which of the following evaluates for a DVT? A, descending venography, B, ascending venography, C, nuclear medicine venography, or D, radiation therapy venography? The answer is B, ascending venography. Question 26. Which of the following evaluates valvular incompetent retrograde flow in the lower extremities? A, descending venography, B, ascending venography, C, nuclear medicine venography, or D, radiation therapy venography? The answer is A, descending venography. Question 27. What does this Doppler waveform demonstrate? A, obstructive flow, B, helical flow, C, laminar flow, or D, retrograde ICA flow? The answer is B, helical flow. Question 28. An ICA-CCA ratio starting at what will determine a 70% stenosis? A, 2.0, B, 1.0, C, 4.0, or D, 3.0? The answer is C, 4.0. Question 29. Based on this AVF diagram, where will blood flow become more pulsatile with higher resistance? A, B, C, or D? The red arrow represents arterial blood flow, and the blue arrow represents venous flow. The answer is right here in region A. Question 30. The percent stenosis calculation is based on which of the following? A, NASCET, B, ALARA, C, OSHA, or D, JACO? The answer is A, NASCET. Question 30. What is occurring during the waveform labeled 4? A, early atrial contraction, B, early ventricular contraction, C, late atrial contraction, or D, atrial filling? So what is happening right here? The answer is D, atrial filling. Question 31. When a patient breathes in, A, the diaphragm raises and the thoracic pressure increases, B, the diaphragm raises and thoracic pressure decreases, C, the diaphragm lowers and abdominal pressure increases, or is it D, the diaphragm lowers and abdominal pressure decreases? The answer is C, the diaphragm lowers and abdominal pressure increases. Question 32. Based on this AVF diagram, where will blood flow start to decrease in pulsatility and resistance? A, B, C, or D? The answer is right here in this region, so B is the answer. Question 33. When a patient breathes out, A, the diaphragm raises and thoracic pressure increases. B, the diaphragm raises and thoracic pressure decreases. C, the diaphragm lowers and abdominal pressure increases. Or is it D, the diaphragm lowers and abdominal pressure decreases? The answer is A, the diaphragm raises and thoracic pressure increases. Question 34. Click in the area of this AVF diagram where blood flow is turbulent. The red arrow represents the native artery, and the blue arrow represents the native vein. The answer is right here. You'll find turbulent flow right in between the artery and the vein. Question 36. Which of the following does this artifact resemble in the CCA and the internal jugular vein? A, dissection. B, fibromuscular dysplasia. C, true aneurysm. Or D, neo-intimal hyperplasia. The answer is A, dissection. Which is known as a pulseless disease? A, Raynaud syndrome. B, Brugger's disease. C, thoracic outlet syndrome. Or D, Takayasu's arteritis. The answer is D, Takayasu's arteritis. And that concludes all the questions for this test. I'll hurry and write more questions and upload that video as fast as I can. If any of you have any questions about your upcoming vascular boards, feel free to email me at ultrasoundboardreview@gmail.com, or you can personally text or call at 435-922-1635. I'm Jim with ultrasoundboardreview.com. We'll see you next time.